I don't know. I gotta get taller. I'm thinking I'm gonna lengthen my femurs by like 4.5 inches. I'm gonna be transferring the funds to their clinic soon. I just,
You're serious?
yeah, I mean,
You know you're crazy, right?
no, I'm not. I'm just.
What's up guys, Victor here, and today we're going to talk about why over lengthening your legs is a huge mistake. Look, money can get you a lot of things in life, but limb lengthening, it just doesn't work that way. It's not a more money, more height kind of deal. Just because you can pay for a way to increase your height doesn't mean you should max it out. So we're going to talk about the 4 reasons why you should not over lengthen your legs. 2 of them are complications that can, mess up your mobility and bone healing, and the other 2 can affect how you look and how you move long term. So let's get into it. The first complication is a muscle contracture, which you could get if your muscles aren't flexible enough to keep up with your new bone length. Have you ever gotten a really bad muscle cramp in your hamstring or your calf that just won't let go? Well, a contracture is kind of like that, only a tad less painful, but it can be just as restrictive. So if you're talking to a limb lengthening clinic and they promise you something bizarre like 10 to 12 centimeters on any one limb segment, just think what this will do to you when you eventually try to walk, run, work out, play sports. If contractures aren't prevented or addressed early on, then you're most likely going to have a funny or weird looking walk or struggle with simple movements like squatting, getting into and out of the car, going up and down stairs, and things like that. And if it's really bad, you might need to get something called a soft tissue release surgery, where the surgeon will partially cut your muscle to loosen it up just so you can regain basic movement. And that's a whole nother topic, but it can further mess up your athletic potential. So I'm sure you don't want that. In fact, I know a patient who went way past what his body could tolerate, and although he did go to a questionable clinic, but he definitely over lengthened, he didn't do proper PT, and he developed a severe knee and hip contracture. And even after multiple soft tissue release surgeries, even to this day, he still can't straighten or fully extend his knee. I think it's at about 15 to 20 degrees, where 0 to 5 degrees is considered normal. So how do you prevent muscle contractures? Well, number 1 is stay on top of your physical therapy. It's easy to talk about hitting your lofty lengthening goal, but actually achieving it is a whole nother thing. You're not just lengthening bone, you're forcing your muscles to lengthen and grow beyond their natural limit.
Will stretch and grow.
Right.
It's a term called distraction histogenesis, which
Okay.
means that the tissues will actually stretch and grow.
So you're gonna need tons of rehab, as in 2 to 4 hours per day, depending on the patient. Number 2 is don't over lengthen. That's the whole point of this video. Think of limb lengthening like a sports game. If physical therapy is your offense, then not over lengthening is your defense, and you need a little bit of both to win the game. Next, keep your surgeon updated with how your body is handling the lengthening process. If you develop extreme muscle tightness, where if you're a femur lengthener and you can't fully straighten your knee, or you can't bring your foot towards your shin if you're a tibia lengthening patient, these are major warning signs that should be brought up to your surgeon at the biweekly checkups. So the next complication that could happen with over lengthening is poor bone healing. Look, the whole point of limb lengthening is to break your leg or legs, lengthen them apart, and allow the lengthened gap to fill in with new bone tissue. A lot of times you'll hear surgeons call this bony matrix regenerate, but here's the thing. If you over lengthen, you could potentially slow down this process quite a bit. And this delayed bone healing, or delayed union, or worse, a non-union where the bone doesn't heal at all, could mean a longer time on the walker, the wheelchair, or crutches. And because your bones don't heal enough, you're not going to be walking, or at least not normally. And this could delay you getting back to normal life, work, gym, leisure, and so on. I've spoken to a lot of patients over the years, and the ones who lengthen too much usually end up waiting months or even sometimes a year or more before they can walk without assistance or their lengthening device. So how do you prevent poor bone healing? Well, number 1 is watch your distraction rate. How fast you lengthen your bones can have a direct effect on how your bone regenerates. Number 2 is to help support your bone healing with proper nutrition, supplementation, permitted weight bearing from your surgeon when they say it's safe. All of these things can support faster healing. And genetics can also play a role, but I think you and I know that we don't have much control over that. And then finally, don't over lengthen. Don't push past your body's limit to form good quality bone. More length equals more healing time. Be realistic about your goals. This one can be hard, especially if the clinic you're looking into is trying to sell you a number instead of safe goals. And lastly, pick an experienced surgeon who's well-versed in checking all of these factors to keep you on track. Like, seriously, a good surgeon is like a coach in the game of limb lengthening who will lay out the game plan, and you just have to do your job and execute it perfectly. So you don't want to look like a cartoon character? Well, then your proportions matter. And these refer to how your body will look after lengthening, and they include your height, your leg to body ratio, your arm to body ratio, your interlimb or tibia to femur ratio, and the one that matters most, in my opinion, when it comes to determining how much you should lengthen in the first place, the arm to torso ratio. Patients will usually only focus on the interlimb ratio when they're lengthening one limb segment, say the femurs or the tibias, but honestly, that's the one that matters least when you're fully clothed. And the reason why is because how we people perceive symmetry can be altered by illusion. In this case, your clothes and your leg mass. How you dress and how much meat is on your legs can make a skewed limb segment that is numerically out of proportional actually look proportional. Limb lengthening magic. So if you over lengthen your femurs or your tibias, then your legs can look disproportionately long compared to each other, as well as to your height. If you overdo it, no amount of clothing or muscle mass will hide your bad proportions, and you might receive a lot of double takes when you're out and about in public. I've seen a handful of patients who went too far. One case that comes to mind is a guy that lengthened his femurs 4.5 inches, which is like, I think it's like 11 centimeters or something crazy like that. And even with pants on, his legs just looked off to me. And I'm sure that it would also look off to the average person with the untrained eye. And if the patient realizes that other people are watching them, I think it can mess with their confidence, even for the people who say that they don't care what others think. If we're sane, I think that we all care a little bit, even subconsciously a little bit. So be sure to check the mirror as you go. Don't just chase numbers, see how your body is changing on a day-to-day basis. Good surgeons will often mention this to their patients before they even start the process. For example, take it from Dr. Robbins.
I guess what these people are doing, 10 centimeters in just the femur, at some point it's a lot for your body to recover from. And then at some point it's also about aesthetics. So an 8 centimeter lengthening in a 150 centimeter person is probably similar to a 9 centimeter lengthening in a 175 centimeter person if you're looking at proportions, whatever those numbers work out to be. So I'm not going to be the one to say, oh, 9 centimeters makes the disproportions look terrible, because it's not up to me. As we've talked about, and any of my patients will attest to, I'm very, very big on, once we get past 2 or 3 centimeters, I say to my patients and their families, take a step back and don't just look at your height on the wall. I want you to actually focus your eyes on your legs, and not just as you stand, like put on not a lot of clothes so you see your legs all the way, like a bathing suit or something, and then sit in a chair and look from the side, because I want you to see how your femurs are elongating, your tibias are elongating, or where your knee is relative to the feet and relative to your hips. I don't want you to just focus on, I'm now 4 centimeters taller. My head is taller than where it was, because it's getting there through lengthening one segment, majority femur, or 2 segments, then the proportions remain more normal. But it's, at some point, we all agree, this much would probably be too much in one bone segment. Now, if I'm 9 feet tall, maybe it's not, and then it's a proportional thing. But I've seen people who have had 11 centimeters on their tibias. And and he was very thin, and they did lengthening over nails, and then he got infected, and then they put plates in him, and then he went into valgus, and then he got Aquinas contractures, 11 centimeters, shockingly. It's a big, long reconstructive process. And basically, I cured his infection. I got him straight. I helped him with his Aquinas, but we didn't cut out 4 centimeters of bone, which you actually could do. You could do tibia shortening. He didn't want that. But the point is, he was very thin, and he had knobby knees, and he wore tight-fitting clothes. And when he was standing, his knees just looked disproportionately high, 11 centimeters. Difference between the foot and the ankle.
If you have someone you trust, you can ask for their opinion, or if you're really unsure, you can schedule a call with me. I'm involved in natural bodybuilding, where symmetry and proportion is the name of the game, so I don't know, I might know a thing or two. Finally, split it up. If you know you want a lot of length to really boost your height, but it won't look natural with just one limb segment, then maybe lengthening some in your femurs and some in your tibias will be a better approach than maxing it out in just one segment. It'll also help with the final aspect that we're going to discuss, which is biomechanics. How your body moves. How you walk, how you run, how you jump, how you lift weights, and so on. When you change the length of your bones, you change your body's movement patterns. So, for example, if you lengthen just your femurs, your squats and other hip hinge exercises like deadlifts, they might feel a little bit off. Or if you lengthen just your tibias, then your knees will be elevated higher during squats, which can affect your spinal alignment at full depth and lead to compensations like a posterior pelvic tilt, or in the world of lifting, we call it a butt wink. Just doing limb lengthening of your femurs or your tibias will alter your biomechanics, and it will make things feel a little bit weird, but you will adapt to that. But if you over lengthen, your body may never adapt. It might never adjust, and this could lead to lasting discomfort or even pain. That's why I might sometimes hear from patients a year or so after surgery that, just are dealing with these joint aches long after most other patients have adapted. I'd say about 75% of people who do this surgery only lengthen their femurs. Why? Well, it's more bang for your buck. You get more length, you usually heal faster, it's usually a few $1,000s cheaper, and oftentimes it poses less overall risk of you developing a complication, although that can depend on the surgeon's experience. But for those who over lengthen, they usually struggle to adapt to the biomechanical shifts. So here are some tips. Keep your lengthening goals realistic. If you're an athlete or an active person and you want to get back to a high level of performance or functionality and get back to doing things like squats, deadlifts, and all that fun stuff, then I suggest you lean a little bit more conservative with your increase in bone length, which it's different for everyone depending on their starting bone length and other factors. But the reason is that you're gonna notice a huge increase in height, but you're gonna be able to better adapt to those changes in biomechanics. Next, you should adjust your training. If you lengthen only your femurs over 6 to 6.5 centimeters, you're gonna notice that you're gonna need to take a wider stance so that you can hit the same, squat depth that you hit before surgery. And finally, consider a 2-surgery approach. Like we discussed earlier when we were talking about proportions, if you want a substantial increase in your height that isn't safe for just one segment, then split it amongst the tibia and the femur surgery and separate into 2 different procedures over time. It'll help you maintain a more natural movement pattern and less biomechanical strain. Look, limb lengthening, it's not just about gaining inches. It's about getting what you can get safely while maintaining your mobility, your aesthetics, and your long-term health. If you max out your length, you're just trading short-term gains for long-term problems. So here's how you do it right. Set a realistic goal, lengthen and observe. I can't stress this enough. If you remember one thing from all my blabbering, from all my videos, it's this. Don't just chase a number, pay attention to your body. Keep your surgeon in the loop. They're experts in this process, so keep them informed along the way, okay? And lastly, make sure that your body can keep up. Your muscles, your bones, your nerves, all of that. And keep in mind your proportions and your biomechanics. They all matter. So if you're considering limb lengthening, which of these 4 risks of over lengthening worries you most? Drop a comment below. And if you want my opinion about your specific case, or to talk more in depth about any of these topics, schedule a call with me. Link in the description. And as always, if you found the video helpful, do me a favor, hit that like button. Be sure to subscribe. And until next time, this is Victor from Cyborg for Life, signing out. Peace.